can't get the needle to move because they're all depressed.
Yeah.
Mental health was this huge part of, I know the blood sugar should be important to me, but when you don't give a hoot about doing your day, the last thing you're going to care about is your A1C. So I started screening everybody for depression. Just said, you're going to do their blood pressure, you're going to weigh them, you're going to take their blood, you're going to make them PHQ-9. So we started screening them for depression. And as offensive as that was in 2001, it became standard practice. Here's the lines you tell the patient, I need this done. Please fill it out. You're going to fill it out every time. I'm trying to monitor how you're thinking. And when you have severely, I didn't know that Salt Lake City, Utah at that time was the #1 female depressed market in the country. And most of my practice was females.
Wow.
And so that became this other part where you're like, I would love to be great at the A1C, but I'm never going to be great at that if we ignore their mental health. And that was novel at that stage. But coming to it honestly of, okay, let's help with that.
What's the driving force, do you think, in our mental health problems back then and today?
Yeah. Gosh, I have a much better answer today than I did then. I mean, you cannot escape that. First of all, in my career, in the last 30 years, the explosion of how we see the brain, how we understand the brain, what a great privilege to get to witness that in patients and in medicine. And then to try and keep up with what do the experts think is the cause of this improvement or this setback, and then what's the truth?
Mm-hmm.
I think you couple that with my intense desire to know the community, the person in a way that's a little broader, that fits with being from a town of 800 people. Like, oh, give me some more story. Give me some more story. Why do you behave this way? And then, so to take what the science has shown us, what the imaging has shown us, and then don't dissociate that you are a mind, body, and spirit, that you should never silo into different sections of medicine. It should be this holistic approach. You got to fix chemistry first. If I could go back and tell my younger self what would I do differently, I would focus on that what I call chemistry set in their blood.
Mm-hmm.
Like, you can't do this when your insulin's that high. You just cannot win. Insulin will dictate what you are doing, and it is such a massive problem of everybody lives with a high insulin, starting at age 12. I mean, and what does that do? It decreases your sex hormones. It changes the way those neurons divide. You cannot mature a brain. You cannot sleep well. That chronic inflammation that is subtle, and healthy people, you're not going to notice it till it's been there for 10 years.
Wow.
And so step one is that has to be in the reversal bucket. You cannot be making that many cytokines a day and think that you can make a brain work better.